everyone. Thank you very much for joining us for this year's International Conference on Software Engineering and Machine Learning. My name is Festus Adedoyin, and I am a senior lecturer at the Department of Computing and Informatics, Bournemouth University in the UK. My presentation today, my keynote speech is about co-creating software, web apps, and telemedicine platforms. And I will be using a case study from my own research in digital healthcare interventions for underserved communities like the LGBT communities in Africa, using Nigeria as a case study. And what do I mean by co-creation is solely collecting user intervention data before proceeding to create a platform, understanding the needs of the users before proceeding to go into the developmental phase of any project. This is not new knowledge. There are so many developers and researchers, academics all over the world who conduct pre-development questionnaires and interviews and client interfacing, understanding the problem, reading about the problem, comparing existing solutions in the market before actually creating the solution, and also creating room for improvement in some of these interventions. However, my keynote speech today argues for a different approach, which is about engaging in interactive management workshops for specific users before conducting the development. So pre-developmental stage, but actually understanding the problem a bit more, especially in cases that relates to digital health for underserved communities. And so I will talk through the Nigerian context just a little bit to give you, to argue for the need to understand the context in the domain before actually proceeding to go ahead with the intervention. And I'll talk about the objective of my keynote speech today, and also argue for why we need technology-driven solutions, but actually why we then need co-creation workshops more before investing millions of pounds or dollars in actually launching a solution or adapting a solution, whitewashing a solution, and so on and so forth. And just to start, this argument I make in this presentation is for trying to understand who are the people. So in this case study, for example, we're looking at LGBTQ people in a region where it is highly criminalized. So it's 14 years in prison if you are found to identify with the LGBT community in some countries. Because of that, these members of the community, particularly men who have sex with men and transgender people, in such communities, those who have HIV/AIDS amongst them would normally withdraw from counseling or coming forward for support. And so there are higher rates of HIV/AIDS within that community, but there are also a higher rate of mental health problems and several other issues around discrimination, criminalization, and so on and so forth. So first stage here in my conversation, before we get into the technology-driven aspect of things or the software development aspect of things, or understanding the big data elements of the attitudes and behavior and so on and so forth, we need to first understand the problem. So my keynote speech here now to start argues for understanding the context. And because of this unique problem within the context of this case study, there is a need to have digital interventions. So we need to create technological solutions that can help healthcare provision. So we look beyond the identity in this case to try to understand what specific technological tools can we create that can accommodate sufficient access to healthcare. So working with NGOs, these are different actors within that community using Lagos State, Nigeria as a case study. Working with NGOs, working with social workers, working with religious bodies to try to understand how can we create a confidential and a very secure technology platform where they could have access to counseling, they could have access to testing, they could have access to viral load, education, and so on and so forth. And so the objective of this pre-developmental stage is, first of all, to try to understand how do we maintain viral suppression, reduction of viral suppression, enhancing viral suppression through technology solutions. But more importantly, before launching into the writing the codes and coming up with all the solutions, how do we co-create the solution with the people who work with them? So we argue for the need to engage in an interactive management workshop where you sit down with the users, so people who work with them. So these are carers, clinical psychologists, medical doctors, pharmacists, who work directly with these communities, and have a conversation around what exactly will be the needs, what kind of features should we argue for, what works better. So if I'm a medical doctor and I work with the patient, what sort of web app or telemedicine platform, what features do you think are best practice or would be most suitable to accommodate this the provision of these services? And so we ask a very clear question: how can technology help people to stick to antiretroviral therapy? Again, going back to the base, so for the users of this software solution, going back to the base, what are the reasons? Why do people not come forward to actually come for testing or to talk to somebody, especially because of the identity? So if I'm a transgender person, or I'm a man who have sex with another man, and I live in a region that is highly criminalized, can I find a platform, a software, an app, or a telemedicine platform that I can use to get support? So basically, this is the core question, to make sure I'm in touch with the doctors, I'm in touch with the pharmacists, I'm in touch with those who would supply some information or some testing or some mental health counseling sessions, services, and so on and so forth. And within the literature, so ideally, traditionally, what people do is to go into the literature and try to see what exactly, how does it work elsewhere? And there are three examples, I document in this keynote speech. One is technology-driven solutions, so self-management, online delivery of services. People seem to struggle with this. So there are, unsupportive environment, fear of disclosure, or what if I speak to a doctor who refers me to a pastor or a religious person to say, why would you identify as an LGBT? You need support, and says, okay, you need to go to a church or a mosque to be helped. So there's that fear. So if we stick to a self-management platform or online delivery of services, or an approach where you could have pickup of medication and so on and so forth, there are real challenges with that. So as a developer, I need to understand what exactly is the problem with merely creating such a platform. So there are fear of disclosure or breach of confidentiality. Even if you do have a secure platform, are we confident that the carers are genuine in looking after the patient within this platform? So there is that problem as well. And there's also the cost of, getting the services or making use of the services. That's one sort of, technology-driven solution. The second solution argues for providing an advanced medication like a chip or a tracking device, or a systematic way, maybe an algorithm-driven patient factor calculator, or something that sort of measures or alerts you to say, you know what, you need to use your medication because your viral load is getting really high. So again, there are problems, there are issues even with that kind of technology-driven solution. And thirdly, what if we have an advanced way of collecting data that tells us exactly your medication is running low, and you do need to quickly contact your doctor, or to contact the pharmacy, or to contact your drug pickup venue for more, or for a sort of a boost of the medication. So these are some of the generalized sort of arguments, when as an academic, when you look at the literature, when you see some of the research conducted elsewhere outside of Nigeria or Africa, you see some of these solutions being suggested. Now, these are fine, but the challenge with it is it may not work with the client. So as a software developer, you want to sit back and think of what other means could I use to actually help me to reduce the high risk of transmission, and also, to also sort of argue for enhancing access to ARV services. So ARV services, antiretroviral medication or antiretroviral therapy services. Now we're talking about, remember, transgender people and men who have sex with men who live in a place like Lagos, where they're exposed to people being against them, they're supposed to, being imprisoned or being reported, and so on, and lots of stigmatization, and so on and so forth. So within that context, as a developer, it costs a bit more to use this approach that I argue for in my keynote speech, which is the interactive management sessions. To say it's a bit expensive because you need some expertise to actually host the session. This is different from focus groups. But as a developer, most developers work in silos to just look at a sample of a platform and try to replicate or improve on existing platforms. But I do argue for utilizing interactive management sessions. So there are risks here. For example, some people argue for sensitization of young adults who live within this region or who are within the LGBTQ community in such a region like Nigeria, for example, and to try to increase accessibility for technological-driven solutions. But what kind of technology-driven solutions are we talking about? And how can we co-create the solutions with those who are going to use that solution? So there are millions of apps on the App Store that are not being used. They're not really useful because they cannot be adapted to all scenarios. And as much as you could try to understand how to design the software sort of platform, for example, speaking to medical doctors within another region to try to understand what kind of needs or what kind of content or features do I need to consider, you still need to carry out an interactive management session, which I'm happy to talk about. So what we've done, what I've done in this case study is to try to co-create this digital solution. In this case, we're talking about a telemedicine platform. So to try to co-create the content, the features of that platform, starting first with an interactive management workshop. So this workshop happened in Lagos, where we put together software developers, healthcare workers, religious people, social workers, pharmacists, clinical psychologists, medical doctors, all together within a workshop, a 3-day workshop, or depending on what the budget is for this sort of pre-development stage of data collection, to try to understand what is the problem and what kind of there are key core questions that have been asked. What kind of solution do we need? So if we compare a solution that works for, say, for example, LGBT community in the US or in the UK or in Canada or somewhere else, to try to understand how it works in those places, but can we import that sort of setup into a place like Nigeria or within Uganda or a different country in Africa? And so this was the session, and these are professionals, as you can see from this slide, who talked to about the issues on ground. And there are core questions. So this is how the interactive management workshop works. You ask a very clear question to say, this is what we are going to be talking about. And in the next slide here, we ask the question, what digital intervention can we use, can we develop, which will improve antiretroviral medication delivery and usage? So we're saying, okay, if we develop a telemedicine platform, as developers, if we create a software platform, and the question is, what exactly are we looking out for? What is most important? What sort of features do we need to capture within this development? And we're saying specifically, we're looking at medication delivery. And now going back to the context of the problem, the medical challenge, the problem of HIV/AIDS is there, but also the unique feature of the users, so the community, the LGBTQ community as well. So how do we create a platform that suits this community whilst achieving suppressing viral viral suppression as well. So it's two objectives in one. What exactly are we trying to do? And to whom are we trying to create this solution for? But what exact features are we looking out for? And the argument here is for medication delivery. So the problem with medication delivery, before I go into some of the issues, the core issues here, the problem with medication delivery is transgender men and men who have sex with men are found to move a lot within Lagos. So this case study, for example, looks at Lagos. So we're going to develop a technological solution that focuses on Lagos State, Nigeria. What we are saying is we know that they move a lot. So because of the way they've been treated and the way the society stigmatizes them, they move around a lot. So someone can live in a Ikorodu for a week, and because it's been exposed, or people are beginning to suspect and sort of stigmatize that person, maybe because of the way they work or because of their gestures or just some perception around that, they would move again after 1 week, say, for example, to Lagos Island. And before you know it, again, they spent 1 week in Lagos Island, and then they move away to another platform, to another city or another region. And because of that, it's very difficult to deliver medication to just one address. So even if you have a technological-driven drop-off and pick-up system, because of that moving around a lot, it becomes impossible to have just one single address. And within a technological platform, say, for example, an interface where you have a very secured record database, you'd seem to see several addresses popping up. So for one client registered on your database, you might find 6 addresses in less than a month or more. And so it becomes very complex for the clinical psychologists and the medical doctors and the pharmacists to understand the delivery and the usage and to monitor, to have a track record of consistency in usage. And that's the problem with medication delivery, excuse me. Now we move on to usage. Is there a system where we could actually ensure that the medication is actually being used? And there are so many complications with usage as well. So what kind of technological platform can we create if we do not genuinely understand some of these issues? And so the interactive management session gives you the opportunity for people who work with the users to create sort of suggestions now. And as you can see from the slides, we have key population here means, men who have sex with men. There are about different categories, but men who have sex with men and transgender people are more at risk. There are also sex workers there and so on and so forth. But we find that some suggested, why don't you create an intensive care app? And what this care app will do is it's going to monitor access to medication and delivery as well. There's also an argument for, okay, why don't we have a reminder feature that says, well, you haven't used your medication, like an alarm system, again, on the same software, on the same telemedicine platform. Or somebody argues for, in-app telemedicine consultancy. So again, you see lots of features popping up, and it becomes very complex to think about these as a developer. You think, oh, wow, we need to take it easy. This is a lot of features. But again, they are thinking about the problem, because they know what the problem is, and they know why there's a lot of money coming from the United Nations or from the United States into solving HIV/AIDS, especially the USAID. But there isn't any, there's still a lot of cases, and the numbers keep rising. There are some efforts, traditional approaches, but is there a way we could create a digital platform that can help resolve this? So these people who work with them understand what the problem is, what the issues are. So there's a suggestion for drug request viral load that you could request for medication remotely wherever you are, and then you could have just a multiple address bar, and this medication can be delivered. There's also a suggestion for having an algorithm where you could automatically calculate drug interactions. So for example, if I use this medication with that medication with that medication, and I have lots of pills to use, is there an algorithm that could technically tell me what the risks are when I use different medications? Is there an algorithm that could alert the professional, the healthcare professional, to say, if I'm using these 3, 4, 5, 6 medications, can I use a blue pill as well to enhance my sexual intercourse? Or does it, is there a risk there if I use a blue pill alongside these 3, 4, 5, 6 medications, and I'm going to have oral sex? What does that mean? So would there be an algorithm that could calculate and pop up a risk? So like a red alert or an orange alert or a green alert that says, well, there's a risk here because if you use this medication by just typing in, oh, I've just bought this medication, if I put it on the system, the algorithm runs and tells you, oh, no, you shouldn't do this because there's a risk to your heart or to your liver, and so on and so forth. So there's that suggestion as well. And there are several other suggestions, like having an avatar that demonstrates usage. And that's very good. That's education aspect of things. And so to educate you as to say, you shouldn't be doing this, or you should do that, or this is how to sort of, use the medication, and so on and so forth. There are also suggestions around booking systems, monitoring systems, stars, OK signs, thumb up signs, and so on and so forth. A feature that lets you track consultation data that says, well, you're going to be meeting your clinical psychologist next week. Are you available or are you not? Are they available? So a platform. So there's a whole lot of, this is very deep, because how can we have one telemedicine platform that can accommodate all of this? So what do we need? Do we need multiple platforms? Do we need one platform with diverse features or access to other platforms? It becomes very clear from an interactive management workshop. And finally, as I begin to round up, I also argue that software developers, machine learning experts, data scientists need interactive management workshop at the pre-development stage. And the need for this interactive workshop is to again expose them to understand what specific solutions do we need. For example, from this slide, we see development of friendly app or a chatbot, a secure platform, again, considering the nature of the disease, HIV/AIDS, but also the identity of LGBTQ persons, people who identify with that community. So it becomes clear to think of how and what should be created and exactly what is it going to address. So these are some of the arguments that I make in my keynote today, and I look forward to having more interaction from this conference. I look forward to having a conversation around what exactly do we need in terms of pre-development data collection. Again, as I mentioned at the beginning, there are several approaches in terms of using questionnaires, client discussions, and so on and so forth. It becomes very messy when you talk to a client who says, I need this, I need this, we need to have that, we need to have that, we need to have this, we need to have that, and the developer becomes confused. This is impossible. How do you expect me to do all of this? And again, budget is limited and so on and so forth. But an interactive management workshop gives a scope and lets us see exactly what we can do within a specified period of time. I thank you very much for the opportunity to share this keynote. I look forward to questions. I look forward to emails, and we could take it up from there. If you're interested in digital health interventions for key population, LGBTQ community people in Lagos and Uganda or other countries in Africa, please feel free to let me know. And thank you very much for your time. Thank you.